we have expert dietitian, Ms. Seema Kashyap. She's an accomplished accredited practicing dietitian with a robust educational background in nutrition and dietetics, complemented by extensive experience in clinical and community settings. With a Master of Nutrition and Dietetics from the University of Canberra, Seema is dedicated to enhancing patient health through evidence-based nutritional interventions. Her professional journey includes role in aged care, disability services, and private practice, where she has demonstrated a strong commitment to improving the well-being of diverse population. Known for her collaborative approach, Seema effectively works with healthcare teams to develop tailored dietary plans that addresses individual needs, promote recovery, and foster healthy eating habits. Fluent in English, Hindi, and Punjabi, she brings a culturally sensitive perspective to her practice, ensuring that all patients receive compassionate and comprehensive care. We would now like to invite Ms. Seema Kashyap. And everything looks connected, right? If it's heart, it's kidney, and the best, your gut has to be really, really healthy. So please talk to Seema, do come in. This was a very important topic, I was thinking very
Good afternoon, everyone. Most of people know me, maybe some of them may be unfamiliar with me. Thank you for the wonderful introduction. So I think most of the doctors have already explained about the diet, the role of diet in the different diseases. So diet is just like a fuel. You fill in the car. If you fill your car with a low quality fuel, your car will at some stage will stop working. So you have to be very conscious what kind of quality you are using to fuel your body. So every time we eat, it just gives an opportunity to get a right nutrition. But it depends what you eat and how you eat, what is the portion size, and what is the timings, and other factors as well. So without wasting any time, let's get started. So basically the diet actually directly influences not only the physical health, but also the mental health and well-being as well. So the food choices we make actually can prevent the diseases at early stages, especially in those cases who have a family history of different diseases. They should actually take care of their diet more seriously. So some choices actually can prevent the causes of disease, like doctors have already said, like the heart disease, diabetes, and obesity. Obesity is actually the root cause of many diseases. So usually people think dietitians only work with the weight management. Sometimes they think, okay, what kind of diet I should follow. So they usually they like to download the diets from the simple diet plans from the internet. So I would just encourage you to all guys to maybe see the dietitians, because they can actually tailor your diet according to your preference and your medical requirement. So good nutrition is essential for long living and healthy life and maintaining vitality. So what are the role of the diet? As I already told you, to maintain the healthy weight, it also helps to build the immunity. So you will see, like most of the conditions, if you do not have a good immunity, you are more prone to get those infections and the viral. So the bad diet actually can cause different kind of problems like obesity, diabetes, hypertension, and certain cancers as well. Small changes actually can make a lot of difference. So I'm not here to encourage you to start, very strict diet just and do it for a few days, and then you get fed up, and then you just stop everything, and then you get bored at if you just follow a very strict diet for a 1 day and 2 days and 3 days, and then after that you get bored and you just don't want to go for the diet because our focus is not clear. The focus should not be only the diet, it should be the whole lifestyle. So impact of poor diet, as I was telling you, so if you're not having a good diet, so these things could happen. So obesity is a root cause of many diseases like excessive intake of fats, sugar, trans fats, processed food can lead to weight gain. So if your BMI is above 25, so you are more prone to get a different kind of diseases. Some other factors are also responsible for causing other diseases. So in case of diabetes, if you have a family history, as other doctors have already described in their presentation, if you have a family history of obesity or diabetes or heart diseases, you have to be very conscious at very early stage so that you can prevent for further progression of the disease. So in a diabetes, usually they have a family history as well, and then we do not bother to encourage our child or during teenage. We just so much indulge in having high sugar food, refined food, low fiber food, and actually it drops the insulin level. So as one of my senior doctor has mentioned, reading a nutritional label is very important. You have to see what serve sizes and what is the whole servings in the whole package. You have to learn, actually they have all the mentions in amount of sodium and the amount of sugar in there. So you have to be very mindful while choosing a food, especially the pre-packed foods. So heart diseases can also occur when you're having a high saturated food. So our Indian cuisine especially is loved fried food, deep fried food. We love pakoras, we love samosas. My husband sitting there, he loves eating all the fried food and he gets fed up I know, but sometimes you can have all these fried food, but in a moderation. It also depends what kind of fats you are using and how frequently you are using the same fat for the refrying. So these things you have to consider. It's too much fat, saturated fat, salt and sugar. So you would be saying the excess of sugar in obesity and excess of sugar in heart disease, how these are related. Some sugars, when you are eating lots of sugary products, your fuel sugar is going to use in energy, but the rest of the sugar will convert it into the fat. So you will be amazing you're not eating any fat or fried food, but you're eating a sugary food and yet you're gaining a weight. So our Indian diet is rich in spices. Few spices actually have a therapeutic effect, can be used as in a moderation for healing or for the curing some of the problems. So a turmeric have inflammatory and antioxidant quality. Ginger also reduces the inflammation. Same garlic helps in maintaining a blood pressure and boosting immune system. Cumin is a resource of iron and antioxidants and coriander. But it depends how you are using these products or other food items and the fruits and vegetables. So as I told you, when we do the deep frying or boiling our vegetables and using in a different cooking methods might spoil the nutrients in it. So you have to choose, to preserve those nutrition, you have to choose the wise cooking methods like the steaming, sauteing, grilling, tandoori. You can use a tandoor, and slow cooking. So these cooking methods actually preserve the nutrition value in the food. So I have divided 4 stages of life. When we born to until 12 years of age, it is called a childhood. So at that time, when child is born, newborn is born, and then until the 12 years. So what is the importance of the nutrition? We need a nutrition for the growth and development and for the bone health. How are we going to get this thing from the food? We need more proteins, calcium, iron, and vitamin D. So we have to make sure that we introduce a child at a very early stage to have a good amount of fruits and vegetables to support their immune system, and also this nutrition helps in building their cognitive development. It is very important to introduce basically all kinds of meals, all kinds of foods, fresh foods, vegetables, herbs, milk, and dairy products at very early age. During, I would recommend to introduce these food during the pregnancy. This is how baby gets also introduced with the food when baby is in the womb, and especially when mother is lactating, it's good to add a more variety of the food in the mother's diet so that the child can also get a chance to have a more nutrition via mother's milk. What is about diet? Heart diseases, diabetes, and blood pressure. So these are some places where we can actually, when we introduce these functional foods in our diet, in a day-to-day routine, at very early stage, and make that as a lifestyle, can prevent some heart diseases like omega-3 rich foods, which you can find in fish if you eat fish. If you are vegetarian, you can get it from the nuts. Seeds also can protect your heart. There's a different kind of seeds. So Indian cuisine have different kinds of seeds which have a very beneficial effect to the heart. For the diabetes, you add in a more fiber, but fiber depends from the which resources. Look, these are the modifiable factors which we can modify. The diet is a modifiable factor. We can modify. We cannot modify the age or any serious medical condition. So what are the tips for healthy lifestyle? First of thing is use unprocessed foods which are not processed. The amount of processing is being done, it means they are lacking in a certain nutrients. So choose the whole food like fruits, vegetables, whole grains, and lean proteins. So if you are vegetarian, you can have your proteins from tofu, pulses, and there are some seeds and nuts as well. And exercise regularly. If you cannot, depends upon your medical condition, if you cannot mobile yourself, you need a help, maybe seek for exercise physiologist or maybe talk to your GP. He can actually refer you some physiotherapist or some exercise physiologist who can actually help you to recommend certain kinds of exercise according to your needs and your extent of doing exercises. So basically, if you're well, you can walk, then you can go for a 150 minutes of moderate exercise and stay hydrated. Water is very important in all 5 food groups. Fluid is also very important. important. So 8 to 10 glasses of water depends upon your condition as well. The water amount depends upon your age, weight. Basically, when we do all the nutrition assessment, it's a 30 to 35 ml of per kg body weight is water is recommended or fluid is recommended. But also in certain medical health conditions, like if you have ascites or kind of a liver problem or renal failure, your water or edema, or in that case, your water requirement is changed. So you have to seek the specialist consultation to so that they can recommend you the amount of fluids per day required for your body. Last but not the least, you have to control the portion size. Sometimes we don't know what is the amount we need to eat. Sometimes we like more rice, and we don't know what is the amount of carbohydrates per day we need. So we have to control the portion size so that we can avoid the overeating. I know some of things like we like the most and then we do not want to stop eating, but it's always a recommended amount. Even if you're having a nuts, it's always a recommended amount, like a handful of nuts, but depends what kind of nuts you want to have. Is that a salted one or unsalted one? So you have to be mindful for your portion size. At the end, I would say the small changes can make a big difference. There is, I would say, like it's a lifestyle change. So you have to change the lifestyle. You have to create a good environment around you. You have to encourage yourself every day so that you can maintain the consistency what you're doing. I would not recommend you to add everything in one day. Start one by one and keep it in a consistency and stay with it. Continue for the long time, because if you just go and see the dietitian and that they have recommended a 1 glass of milk, and then you say, okay, you drink the milk, but when? Once a week. So that is not actually, you're not eating an amount of proteins, and you have to actually continue with the consistency, what changes you are making. So focus on consistency.